Genetic testing revolutionizes diagnosis of neonatal cholestasis. Imagine a world where newborns suffering from a mysterious liver condition could get a swift and accurate diagnosis, paving the way for targeted treatment. This is the promise of genetic testing for neonatal cholestasis, a condition that disrupts the flow of bile from the liver to the intestines. A groundbreaking study in Turkey has shed light on how genetic testing can revolutionize the diagnosis and treatment of this rare yet critical condition. Neonatal cholestasis is a serious issue where bile, a crucial digestive fluid, fails to flow properly from the liver to the intestines in newborns. This blockage causes bile to accumulate in the liver, leading to organ damage and the leakage of liver components into the bloodstream. Symptoms like itching and jaundice, yellowing of the skin and eyes, are common, but the underlying causes can be diverse and complex.
But here's where it gets controversial. While genetic testing can identify the cause in many cases, it's not always the first line of diagnosis. The study, published in the Journal of Pediatrics and Child Health, highlights the importance of expanded genetic testing in clinical practice. Researchers analyzed data from nearly 300 children, and found that genetic conditions were responsible for more than a quarter of the cases. The most common genetic diagnosis was progressive familial intrahepatic cholestasis, PFIC, a rare form of cholestasis caused by mutations in specific genes. PFIC is just one of many disorders that can cause neonatal cholestasis. This condition is characterized by genetic mutations that affect the transport of bile out of the liver. There are several types of PFIC, each linked to different gene mutations. For example, PFIC type 1 is caused by mutations in the ATP8B1 gene, while PFIC type 2 is linked to the ABCB11 gene. The study found that more than half of the genetically diagnosed children were born to blood-related parents, highlighting the genetic component of the condition. And this is the part most people miss. The challenges in managing neonatal cholestasis are significant. Delayed diagnosis, limited treatment options, and the risk of progression to liver failure are major obstacles. The rarity and variability of genetic cholestatic disorders make large-scale clinical studies and therapeutic trials difficult. However, the Turkish study provides valuable insights into the genetic and clinical features of children with neonatal cholestasis. The researchers retrospectively analyzed data from 378 children seen at a Turkish hospital between 1997 and 2024. The average age at admission was 12.5 months, with symptoms starting at around 2.2 months. Jaundice was the most common symptom, affecting 60% of the children. Non-genetic causes of cholestasis included biliary atresia and choledochal cysts. After excluding these non-genetic cases, genetic tests identified genetic causes in 28% of the remaining children. The most common mutations were found in genes known to cause PFIC. Other mutated genes included those involved in bile acid synthesis and transport. The study also measured levels of gamma-glutamyl transferase, GGT, an enzyme that serves as a biomarker of liver function. Low or normal GGT levels were linked to PFIC types 1 and 2, while high levels were associated with PFIC type 3 and other conditions like alpha-1 antitrypsin deficiency and cystic fibrosis. The percentage of children diagnosed with genetic cholestatic disorders increased significantly after 2010, likely due to better access to genetic testing. The researchers emphasized the need for routine genetic testing in the diagnosis of neonatal cholestasis. They recommended that after excluding urgent causes, genetic testing should be performed to achieve faster and more accurate diagnoses. But here's a thought-provoking question. Should genetic testing be the default approach for diagnosing neonatal cholestasis? Or are there situations where traditional methods are still more effective? Share your thoughts in the comments, and let's discuss the future of genetic testing in pediatric liver diseases. Your insights could help shape the future of medical practice and improve the lives of countless children.